In this video, I'm gonna show you how to easily memorize the lysosomal storage diseases. This is a topic that frequently appears in residence exams, especially in the US, and it's a real headache for many because it's full of strange names, complex syndromes, and a bunch of enzymes and intermediaries that are really easy to confuse. To help you remember all of this information, we're going to use one of my favorite memorization techniques, which is the mind palace. If you've never used one before, don't worry, just follow along and try to imagine and really visualize everything I'm going to describe. And yes, at first this whole thing is going to seem a little strange, a little weird. You're gonna be wondering like, why am I picturing this strange image in my mind? But trust me, if you actually do this exercise consciously and with focus, which by the way means no multitasking in this video, at the end it will be much easier to recall all the information. Okay, so the first thing we need to do to create our mind palace is to choose a location. It could be your home, or a friend's house, or a partner house, or even a random familiar place you know for some reason. The important thing is that you pick a specific space you know very well and you visualize it clearly. Once you've picked your space, I want you to picture the outside of that place. The door, the entrance, the gate. I want you to visualize it vividly and to imagine yourself standing right there just a few feet away from the entrance. So I want you to picture that just outside the entrance, there's an epic battle just about to unfold. But this is no ordinary battle. It's quite peculiar. On the left side, the commander is none other than Taylor Swift, the famous pop star. But something seems off about her. You see, she looks kind of drunk. She's stumbling around and slurring her speech, almost falling every few seconds. It really seems like she had one too many drinks. And you also notice that in her right hand, she's holding and waving a really small object. You come a little bit closer and you notice that that small object is a reflex hammer, just like the ones we use. Okay, so Taylor Swift, a little bit drunk, and the reflex hammer. Okay, once you have that picture, I want you to imagine that behind Taylor Swift are her soldiers, which are none other than the X-Men. So yeah, I want you to picture Wolverine and Storm and Beast and all of the others right there ready for battle. But you notice something strange, because instead of using their powers, they're just wielding a bunch of onions. They're threatening the other side by menacingly lifting up and down a bunch of big onions. Okay, now turn to the right. On this side, I want you to imagine that the commander of this faction is Nemo from Finding Nemo. So you see a fish tank and you see Nemo inside there trying to like threaten the other side. But you notice a couple of strange things with Nemo. First, that his fish tank is not filled with water. It's filled with beer. So poor Nemo is also very drunk, just like Taylor, and is swimming very awkwardly in the fish tank. Now, the other important detail is that this beer, as it usually happens when you pour very rapidly a beer, has created a lot of foam in the upper layer, in the upper part of the fish tank. So I want you to imagine that. A lot of foam on the top side of the fish tank, and that foam is spilling all over the place. Now, behind Nemo are his soldiers, which in this case are a dozen of sphinxes, like the ones from Egypt, you know? But these ones are actually alive and moving all around. So I want you to try to picture that image. A bunch of, like a dozen of sphinxes moving all around, playing and trying to threaten the other side. Now, just like the X-Men had their onions, the sphinxes are also playing with the weapon of their choice, which in this case are a bunch of levers. Okay, so imagine some sphinxes gnawing on the levers, others balancing them on their paws, ready to hurl them, and others are menacingly lifting the levers up and down as a threat to the X-Men. Okay, so that was each of the factions, but you also notice that in the middle of the scene, there's a giant cherry, like the size of a basketball. Both factions seem ready to fight over this cherry, and in fact, the whole war, you now notice, seems to be about who obtains the cherry first. Again, these are really important details, so take a couple of seconds and try to visualize it very clearly. In fact, take a moment, pause the video, and try to visualize everything we just said about this scene, and when you're ready, imagine opening the door and moving into the next space. Okay, so in this space, which in my case is my garage, but in your case can be whatever space you are imagining, I want you to picture an elegant dinner table. Sitting at the table are Gaston from Beauty and the Beast and Mr. Krabs from SpongeBob SquarePants. And between them, in the center of the table, there's a brain. a giant, slimy, squishy, and oozing brain. You're not entirely sure if they plan to eat it, but there it is, okay? Now, Gaston has a plate, and that plate contains a giant liver which is skewered by a bone, but not any bone, a huge bone, something like a human femur or something like that, okay? And on the bottom of the plate, there's a bunch, and I mean a bunch of blood pooling, okay? So I want you to picture that. The liver, the bone, and the blood. All of those details are really important, so try to picture them really vividly. In fact, try to imagine how the plate smells and how disgusting it looks. That'll help you memorize the image much, much better. You also notice that Gaston has a drink, but that one is even stranger than the plate, because instead of liquid, his glass is filled with a bunch of sugar and wrinkled paper, okay? Sugar and wrinkled paper. Now, Mr. Krabbe's plate, on the other hand, is filled with milk, which is kind of normal, right? But floating on it are three very, very odd items. The first one is a human eye. So try to picture a human eye floating just on top of the milk. Right beside it, there is a globe, like the ones used in geography class. And finally, there's a crab leg, which, yes, it implies that Mr. Krabs is kind of a cannibal. So again, take a moment to visualize everything we just mentioned from this scene, and when you're ready, imagine moving into the next space. Okay, so this next room is nothing like you remember. The first thing you notice when coming in is that the walls are all painted like a galaxy. Totally black, with stars and a glowing Milky Way all along the space. It's actually quite beautiful. But you know what's not beautiful? The creature that's in the middle of the room. It's a fairy, but it's a really traumatized fairy. Her left arm is totally missing, totally missing. Her right arm is connected to a dialysis machine, and she seems really unable to move because apparently both of her legs are stuck on a ceramic pottery. The wording on that is really important, the ceramic part specifically. So a ceramic pottery just like the one shown in screen, okay? And as if that wasn't enough, a few tiny red bugs are coming out of the ceramic, biting her skin all over the place. In fact, she's all covered in them and desperately trying to get them off. Okay? And that was it. Okay, so now let's go to the Mind Palace and start explaining how each retrieval cue helps us remember the information. And let's begin at the entrance. What did we saw over there? We saw a battle, right? Now, there were a couple of factions. Let's start with the faction of the left. Who was the commander in the left? It was Taylor Swift, right? Okay, so she's there to help us remember Tay-Sachs disease because Taylor, Tay-Sachs sounds kind of similar, right? So every time we see Taylor and all of the left side, we think about Tay-Sachs disease. Everything on this side is going to be related to Tay-Sachs disease. So let's start remembering the details. Okay, let's start with the first thing we mentioned about Taylor. She was behaving a little weird, right? Like a drunk person, correct? Now, that's because Tay-Sachs disease causes progressive neurodegeneration. The ataxic gait, the slurred speech, all of that helps us remember the neurodegeneration. Okay, now I want you to visualize her hand. She was holding something in her hand, right? What was it? It was a reflex hammer, right? The reflex hammer is there to help us remember the hyperreflexia, which is a cardinal symptom of this disease. We see the reflex hammer, we think of hyperreflexia, okay? Now, there were a few soldiers behind her. Who were they? They were the X-Men, right? Now, the X-Men are there to remind us that the enzyme that's deficient in Tay-Sachs disease is X-sosaminidase. X-sosaminidase. So we see the X-Men, we think X-sosaminidase. Now, there was one more detail in this left faction, and it was the weapons. Do you remember the weapons? They weren't using their powers, they were holding some onions, right? Okay, so those help us remember that in the biopsy of patients with Tay-Sachs disease, we see lysosomes with onion skin appearance, okay? Onion skin lysosomes. Perfect. Now let's turn to the other side. Who's the commander of the right faction? It was NEMO, right? So NEMO is there to help us remember that all of these right faction are details regarding Niemann-Pick disease. And I think it's pronounced Niemann. So NEMO, Niemann, NEMO, Niemann. It's easy, right? So just like Taylor Swift, he was also behaving a little bit weird because he was swimming in beer, you remember? So that's there to remind us that this disease also causes neurodegeneration, okay? And do you remember what was on the top of the fish tank? It was a layer of foam, right? The beer with a bunch of foam. That's there to remind us that in the biopsies of patients with Niemann-Pick, there are foam cells, which look like this, okay? And that is a very high yield concept, the foam cells. Foam cells are seen in Niemann-Pick disease. Okay, now, do you remember the army behind Nemo? It was a bunch of sphinxes, right? Okay, so those sphinxes are there to remind us of the enzyme that's deficient in Niemann-Pick disease, which is sphingomyelinase. So we see the sphinxes, which we think sphingomyelinase. All right? Now, the sphinxes were playing around with some form of weapon to throw to the other team. What was that weapon? It was a bunch of livers, right? That's because Niemann-Pick disease causes hepatomegaly, which is a really, really important clue because Tay-Sachs does not cause hepatomegaly, and that's a key differentiating feature. And I think that leaves just one more detail to memorize, which is the object that was in the middle of both armies. Do you remember what it was? It was a cherry, right? A giant cherry. That's there to help us remember that both diseases, Tay-Sachs and Niemann-Pick, both have a cherry red spot macula in the fundoscopic examination. That's a very, very important point. Both diseases share it, and the way to differentiate between them is that Niemann-Pick has hepatomegaly, we remember that by the livers, while Tay-Sachs disease doesn't have that, okay? Great, so let's do a little recap. So in the left we have Tay-Sachs disease, right? Because Taylor, Tay-Sachs. Okay, what did Tay-Sachs have? They have neurodegeneration because of the drunkenness. They also have hyperreflexia. They also have cherry red spot macula. That's like the common feature. Now, the enzyme, it was exosaminidase, right? And in the biopsy, we saw, try to remember, onion skin lysosomes, right? Perfect. Now, on the other side, we had NEMO, so NEMO, Niemann-Pick disease. They also had a cherry red spot macula and neurodegeneration, but they had, what's the differentiating feature? What was the weapon? Livers, right? So hepatomegaly. And this is caused by a deficiency in, try to think about the soldiers, the sphinxes, so sphingomyelinase. And in the biopsy, we saw, try to think about the fish tank, foamy cells. Okay, so pause the video, rehearse that a couple of times, and I promise you'll start easily remembering all the information. In the meantime, I'll continue with the next space. Okay, so what did we saw here? We saw a dinner table, right? And we're going to go into the characters in just a second, but try to remember what was in the middle of the table. It was our brain, right? So that's there to help us remember that both of the enzymes that are affected in the following conditions both end with cerebrosidase. Now, in case you're not sure the logic behind that cue, the logic is that the cerebrum is the largest part of the brain. So that helps us remember brain, cerebrum, cerebrosidases. Now let's move on to the characters. Okay, so on one side of the table, there was a big character from a Disney movie. Do you remember who it is? It was Gaston. Okay, so Gaston is there to help us remember of Gaucher disease. I'm not sure how that is pronounced. I think it's Gaucher. I'm just gonna say Gaucher. Okay, so Gaston, Gaucher disease. Gaston, Gaucher disease. Now, remember what was on his plate? There was a liver with a skewered bone and a bunch of blood. Those are there to help us remember the three key organs affected in Gaucher disease. The liver, hepatomegaly, the bones, which are seen, you can have bone pain, you can have osteoporosis, you can have vascular necrosis, you can have a bunch of bone stuff, and the blood, which causes pancytopenia. So liver, bone, and blood. Now, what was he drinking? It was a glass filled with sugar. Sugar and a wrinkled paper. We're going to go into the wrinkled paper in just a second, but the sugar is there to help us remember the first part of the affected enzyme. The last part of the affected enzyme is cerebrosidase. We already established that. What was the first part? Sugar, gluco. So gluco, cerebrosidase. Sugar, gluco, the brain, cerebrosidase. So glucocerebrosidase. Now, what's up with the wrinkled paper? Well, the wrinkled paper is there to help us remember that the appearance of the lysosomes in Gaucher disease, they are described with a wrinkled paper appearance. So wrinkled paper in the glass, wrinkled paper in the biopsy, okay? Now, let's go to the other side. In the other side, we also spot a familiar face. It was of which character? Mr. Krabbe's, right? So Mr. Krabbe's is there to help us remember of Krabbe disease. And this is probably the easiest cue to associate. Now, what was Mr. Krabbe's eating? He was eating a bowl with milk, right? So milk has a sugar. Which sugar is it? Is lactose. And lactose sounds very similar to galactose. So we think of the milk, that reminds us of lactose, galactose, and there we have the affected enzyme, galactocerebrosidase. Perfect. Now there were three objects floating on top of the milk. Which were they? They were, first, an eye, right? That's because in Krabbe disease there is optic atrophy that eventually leads to vision loss. So the eye leads us to remember the vision loss. Then there was a crab's leg. So every time we see a leg or an arm in this, like in this whole mind palace, we think of peripheral neuropathy. So the crab leg, peripheral neuropathy. And finally, there was like a geography globe, right? So the geography globe is, the important part is the globe. In this disease, the biopsy, we see globoid cells, which look just like this. Globoid cells, really important point to remember. Okay, so to recap, we had on one side of the table Gaston, that reminds us of Gaucher disease. Gaucher causes liver, bone, and blood. The affected enzyme is sugar, glucocerebrosidase, and the appearance in biopsy, we see wrinkled paper lysosomes. Now, on the other hand, we see Mr. Krabbe's, that reminds us of Krabbe disease, and that has optic atrophy, vision loss, peripheral neuropathy. It's caused by which enzyme? The milk galactocerebrosidase, right? And in the biopsy, we see the globoid cells. Perfect. Now, again, pause the video, rehearse that a couple of times, and then move on to the final room, which was, let's start thinking about it. What was happening on there? There was a bunch of walls painted like a galaxy, right? So the galaxy is there to remind us that this last disease, it has a deficiency in galactosidase. Galaxy, galactosidase. Alpha galactosidase to be more technical, but yeah, galactosidase. Now, in which disease is this enzyme deficient? Well, for that, let's remember who was stuck in there. It was a fairy, right? Now, fairy is there to remind us of Fabry. Fabry. So alpha galactosidase is deficient in Fabry's disease. Now, this fairy was in kind of a rough shape, right? Why was that? Because she was, first of all, missing an arm, right? That's there to represent peripheral neuropathy, a key hallmark of this disease. The other arm, on the other hand, the other arm was connected to something. To what? To a dialysis machine, right? So that's there to remember that Fabry's disease eventually leads to renal failure, okay? So peripheral neuropathy, renal failure. And finally, her legs were stuck in something. In what? They were stuck in a ceramic pottery. The keyword here is not pottery, is ceramic. Ceramic is the keyword. Why? Because that helps us remember that the accumulated substrate in Fabry disease is ceramide triexoside. The important part is ceramide. So ceramic, ceramide. And yes, you've probably noticed that in all of the other diseases, there weren't any cues to remember the accumulated substrates. That's because for most other diseases, that information is very easily deducible. For instance, let's take Niemann-Pick. Try to remember Niemann-Pick. Okay, so what was the deficient enzyme in Niemann-Pick? It was sphinxes, sphingomyelinase, right? So if we have that information, it's really easy to deduce that the accumulated substrate is sphingomyelin. Sphingomyelinase leads to an accumulation of sphingomyelin. That's not that hard to deduce, is it? But here it is. So the ceramic is there as an added cue to remember that information. Ceramide triexoside. Okay. By the way, you can add all of these sort of additional details if you need them, and I'll show you how to do that in the end of the video. But in the meantime, let's remember what was crawling out of the ceramic. Do you remember? It was a bunch of red bugs, right? So those red bugs were biting all of her skin and making her look like with a bunch of red dots, and that's there to remind us of the typical rash seen in Fabry disease, which are the angiokeratomas, which look just like this, like red spots all over the skin. Perfect, and with that we finished the explanation. So now let's see if you actually learned the information. So take a look at the following question extracted from the Lecturio QBank and try to see if you can confidently solve it. Pause the video and then leave the answer in a comment below if you can. Alright, so how did you do? If you nailed it, congratulations. That means that the Mind Palace worked. But remember, learning doesn't stop here. You can keep testing yourself easily with Lecturio. Just head over to the concept page of lysosomal storage diseases, click Start, and dive into a hand-picked selection of clinical cases tailored to this specific topic. You can also continue studying this topic with our concept pages, our video lessons, our quizzes with space repetition algorithm, and all the other tools available on the platform. Okay, but wait, what about the other lysosomal storage diseases like metachromatic leukodystrophy or Hunter syndrome? Don't they go into the Mind Palace? That's a great question. So the diseases we covered here are the most commonly asked in the USMLE. But if you want to go the extra mile, you can absolutely add the other diseases to this Mind Palace. You just need to associate the key concepts you want to remember with visual cues and try to place them somewhere along the palace. So let me show you how to do this with an example. Let's take, for instance, a metachromatic leukodystrophy, which is caused by a deficiency in aryl sulfatase. I want to remember like those two key concepts. So if I were to try to add that to the palace, I'd start with the metachromatic leukodystrophy. Okay, so what reminds me of meta? If I remember meta, everything else is easier. So what reminds me of meta? Mark Zuckerberg, right? Because he's the CEO of Meta. So I do the association and that's how I remember metachromatic. Okay, so I have Mark Zuckerberg. Now, what reminds me of aryl sulfatase? What reminds me of aryl sulfatase? What reminds me of aryl? Aryl, maybe Ariel, or maybe Ariana Grande, or maybe Arya Stark. I'll go with Arya Stark. So I have Mark Zuckerberg and Arya Stark. But just picturing those two guys chatting is not really memorable. So I need to make the scene really, really memorable. I try to imagine something funny or something crazy or something impossible. I for myself would try to picture Mark Zuckerberg cradling Arya Stark and singing her a lullaby. It's a ridiculous image, I know, but that's precisely why it works. It's hard to forget. So yeah, that's basically how you add details to the Mind Palace, and that also works for the diseases we already covered. For instance, in my complete Mind Palace about this topic, I picture besides the X-Men a gang of Ashkenazi Jews, because Tay-Sachs causes an accumulation of gangliosides. So I try to remember gangliosides by a gang, and the part of Ashkenazi Jews is because, well, this disease is more common in Ashkenazi Jews. So I try to remember both of those additional details with that additional retrieval cue. So yeah, give it a try, start customizing this Mind Palace to your liking, and hopefully that will help you crush your test. That's all for this video. Thanks for watching, and I'll see you in the next one.